Hi, my name is Robbie Reeser, and I did my research study on conservative versus operative treatment for knee injuries. A quick overview of my topic, I'll briefly inform you about the knee, a quick introduction and lit review on previous studies that I looked up, and then for my research study, my design, my methodology, results, conclusion, and discussion. Excuse me. A quick overview of the knee. There are essentially four separate ligaments that stabilize the knee joint. You have the ACL, PCL, LCL, and MCL. If you're not familiar with those terms, you have the anterior cruciate ligament, the posterior cruciate ligament, medial collateral ligament, and the lateral collateral ligament. And the LCL and MCL stabilize your joint from side to side, so the lateral is on the outside of the knee, and the MCL is on the inside of the knee. Then you have your ACL, which is front and center of your knee, and that is a stabilizer of the femur, which prevents the tibia from sliding forward during physical activity, jumping, being agile. And you have your PCL, which is opposite of your ACL in the back, and that makes sure your tibia prevents your tibia from sliding backward. Ligament injuries are graded anywhere from grade 1 sprain, grade 2 sprain, and grade 3 tear. A grade 1 sprain would be micro tearing or slight stretching but still stable. Many athletes still compete at their high level. They're just a little sluggish. A grade 2 sprain, partial disruption of ligament, obviously a little more painful. And your grade 3 tear, which is complete ligament tear with no stability. If an athlete, especially a professional athlete, tries to continue playing, he won't be agile and the knee will just go out. Elite athletes will always take anterior cruciate ligament reconstruction, which is also known as surgery, while low demand athletes or older people will elect to live with the disability since they're not playing competitive sports anymore. ACL injuries, PCL injuries, MCL or LCL injuries are most common from the knee twisting and from contact. So if you see a leg or knee twist and contact, I mean, you could do the math, and it's never a good sign. Many studies that I looked at, they showed ACL injuries, and athletes were affected physically, and athletes' mindset were also affected post-operative surgery. Studies were done by An and Zhang, and An basically did a non-operative study, and he had 232 patients, and 48 of them elected to go non-operative, and An chose to have these patients not do surgery and see if they'll recover as if they had surgery, if it would be similar in the effects. And the 46 patients were able to return to sport and do just fine, while Zhang looked at the factors and what influenced athletes returning from their post-operative surgery, and a major theme was fear, and athletes were afraid to return to contact sports and their pre-injury level, which is very common. There was qualitative and quantitative research in my study. The purpose of the study is to see which is more effective treatment for patients with ACL or knee injuries. You may think it's obvious that surgery is going to be a lot more effective, but there's some cases where people not necessarily need surgery and they get it anyway because they don't really know the effects of non-operative treatment. Surgery is extremely effective in the long term compared to conservative treatment for ACL or other knee ligaments. I have a small sample size, and it's a timely experiment because patients can't return to physical activity from 8 to 12 months. So it could be a year where an athlete isn't returning to their sport, and it may take longer depending on the person. Studies I looked at was Zhang in 2014. Investigated the effects and factors influencing a patient's decision to return to his or her pre-injury level of sport after ACLR. And he found that fear is a major component for athletes returning from surgery. And then An looked at conservative treatment of acutely injured ACL and if patients would be successful from that. And he did find out that patients can return to pre-injury level even if they don't get surgery. my research study design. Um, After an ACL or serious knee injury, should the patient take conservative or an operative aggressive approach? This is obviously gonna be different for elite athletes versus older people who decide not to play competitive sports, because older people aren't going to return to a competitive level, so they might not need surgery and they will elect to go the non-operative route. There's going to be two groups in my study: control and experimental. The control group will be surgically operative group, and experimental will be patients who choose to take the non-operative treatment. Tests will be full range of motion, running tests, and rehab and strengthening are key for the non-operative and operative group. There'd be 40 participants, 20 male, 20 female. Age will be high school to mid-30s. Average age is 27 plus or minus 10 years, so the youngest participant would be 17 and the oldest would be 37. There'll be a questionnaire and a survey that each individual must fill out. They'll have to follow instructions for rehab, and this should take up to a year or a year and a half, because an athlete after surgery returns a year to physical activity, so it's a very timely experiment. Patients and participants must follow the doctor's and physician's instructions, whether it's don't move the knee, keep the knee stable, keep the knee in a brace, do these exercises, and do these on a daily basis, whatever it must be. But following instructions is key. Results showed us that patients who received operative surgery on their ACL injuries were way more effective and beneficial to athletes. Non-operative patients were able to return to physical activity, however they were not as serious and elite with competition of the sport. Next time, the study could have been all males or all females. That would have kind of narrowed down the gap, because females and males are different. Instead of having athletes be on the same sport, play different sports, they should just be on one sport. That narrowed down, because I understand contact sports are different from non-contact sports, and if there's only one sport, athletes would be in the same situations instead of athletes having higher risks of hurting their knee or not coming back to full throttle because they play a contact sport that is a lot dangerous than others. The age range could have been closer together, and similar competition levels would have been key. Instead of having a wide age range, I could have just had professional athletes, high school athletes, or collegiate athletes. I would have narrowed down the gap and made my study a little bit more effective, I believe. My conclusion: in both cases, athletes will be able to perform the physical activity, whether it was operative or they took the conservative route. Just participants who chose to be operated on, they were a lot more effective to competition levels than the conservative way. Even though you could still get away with the conservative route, you just can't get back to that elite competition level as soon as you think. The results, basically what I just said, show us that surgery is more effective to athletes and professional athletes. Age, what sport they play, and situations they're in will have a big, important factor on what they decide to do. Every individual is different, so it varies. Whether it was Adrian Peterson, who returned 8 months and he had the best career of his best year of his life after he returned from a knee injury, while you have Sam Bradford, who was constantly injuring his knee. You have to wonder if it's the situation they're in or the treatment they got for their knee. They both got surgery on it. So there's all those improvements would be key, and I think make my research study a lot better and more effective. The hypothesis was athletes who do not have surgery on ACL injury will not be able to perform as they once did before the injury. Thank you for your time, and I hope you enjoyed my presentation.